बोलिए।
बोलो, हेलो बोलो।
हेलो हेलो हेलो
ठीक ठीक, वहाँ जाइए। बंद करो।
हेलो।
A very good morning to all of you and a warm welcome. We have gathered here today to celebrate the launch of the Preventive Hematology Clinic, may I say the first of its kind in entire India, under the aegis of Department of Clinical Hematology, King George Medical University. Let's welcome our distinguished guests, our Honorable Vice Chancellor, Lieutenant General Dr. Bipin Puri sir, our guest of honor today, Our guest of honor today, Dr. Anupam Sachdeva from Sir Gangaram Hospital, New Delhi. Our special guest speaker, Professor Tulika Seth from AIIMS, Delhi. And our respected Pro Vice Chancellor, Professor Vineet Sharma. At the outset, let us invoke the blessings of Ma Saraswati by kindling the lamp of knowledge and wisdom. For seeking the choicest blessings for the same, may I invite our admirable guests to come forward and light the lamp, please.
आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः
Now let me invite our dear sir, Professor A.K. Tripathi, Head of Department Clinical Hematology, for the welcome address.
Namaskar. Respected Honorable Vice Chancellor, King George's Medical University, Lucknow, Lieutenant General Dr. Bipin Puri ji, an exemplary academician, scholar, and visionary leader, under whose mentorship there is visible transformational change in the university. Sir, we are immensely privileged to have you here. I welcome Dr. Anupam Sachdeva, a distinguished pediatric hematologist from Sir Gangaram Hospital, Delhi. And indeed, I am very much grateful that you have agreed to grace this occasion on a very, very short notice. Thank you, sir. I welcome Dr. Tulika Seth, Professor of Hematology, AIIMS, New Delhi, who is guest speaker of today's program. She is an internationally acclaimed eminent hematologist, a thorough clinician, and a great, sensible human being. I am very much obliged that you have generously accepted our invitation to be speaker on this occasion. I welcome Professor Vineet Sharma, Pro Vice Chancellor, KGMU Medical University. He is an upright and astute administrator and orthopedic surgeon by excellence. I also welcome Dean of various faculty, head of departments, faculty members, students, staff, guests from media, ladies and gentlemen. It is indeed a matter of great privilege and pride for me to welcome you all at the inaugural program of Preventive Hematology Clinic. There are principally five ways to alleviate human sufferings: preventive, promotive, curative, palliative, and rehabilitative. Remarkable progress in medical research and technology has made it possible to provide safe and effective treatment of various complex diseases and cure in many. However, often the treatment is prohibitively costly. Patients suffer from pain and infirmity when they develop disease. Management of the disease puts the patient and family on huge physical, mental, and financial stress. Therefore, the key to having a healthy, happy, and prosperous society lies in the prevention rather than in the treatment of disease. It is noteworthy that majority of communicable and non-communicable diseases are preventable. Preventive measures have already proven their success through vaccines, provision of potable water, improved hygiene and sanitation, and healthy life. Several hematological diseases which are prevalent in India, such as iron deficiency anemia, B12 and folate deficiency anemia, drug-induced blood diseases including aplastic anemia, bone marrow suppression as a whole, thalassemia, hemophilia, and thrombotic episodes can effectively be prevented. It is very rightly said that investment in preventive programs is the best form of health investment. So, Preventive Hematology Clinic is being started in KGMU Medical University by the Department of Clinical Hematology. This is first of its kind in India. I was searching on the net and I could find preventive oncology at many places, but I could not find any institution running in the name of preventive hematology. People attending the clinic are more likely to sincerely listen to and follow the advice when told by the treating doctor as compared to when they are advised by field workers. Specialists will be available to provide useful information and advice. Attendee will be explained verbally as well as with the help of literature, pamphlets and videos about how they can save themselves from having disease. The Department of Clinical Hematology is a relatively new department. However, it has evolved considerably during the last few years. We have seen 28,156 patients in OPD and admitted 2,434 patients in a single year, 2019. Not only this, we continued OPD and IPD services even during COVID pandemic, so that we have seen 13,400 OPD and 1,667 admissions in the year 2020, even during COVID pandemic. We have a state-of-the-art hemophilia comprehensive care center, which is one of the best in the country. 1,100 patients are registered. There is free facility for factor replacement, physiotherapy, surgery and rehabilitation. Daily footfall of hemophilic patient is around 30 to 40, and 45 minor and major surgeries also have been performed. We have done autologous hematopoietic transplantation in 2 patients, and there was a halt during pandemic time. Now we will soon resume as soon as possible. Patient is said to be center of healthcare, but their voice is too often ignored or put to a side when decisions are being made. Therefore, there is a need to listen more intently to strengthen engagement and adherence to care patient. So we have a unique patient-centric facility named as Jharokha. This is already running in the department. Jharokha means a window of communication and opportunities. And what we have over there, we have open house meeting with the attendance of patients every Saturday, where we take feedbacks, discuss issues, and find ways to resolve it. Also, we felicitate attendance of the patients and give away gifts or prizes based on their performance in taking care of their patients. That includes hygiene, sanitation, compliance, and behavior. And there is a small library also for them, which has around 200 books for patient and attendants. Our next step will be to set up an intensive care unit in the hematology ward, start DM clinical hematology program, and launch another very interesting program, that is community hematology, very soon, where we would like to initiate anemia-free campaign by adopting a village. And finally, I am confident that with the blessings and guidance of Honorable Vice Chancellor, we will be able to have one of the most comprehensive and best hematology department in the country. Thank you.
Vinayak? May I request now our guest of honor, Dr. Anupam, to speak a few words on this occasion.
Good afternoon, ladies and gentlemen. I don't think I can say anything more than what Dr. Tripathi has said as far as preventive aspects is concerned. Let me reiterate that hematology is one of the subjects which has a preventive aspect in every part of hematology, whether it's nutritional anemias or benign hematology in the form of thalassemia, sickle cell disease, or any of the hemoglobinopathies, hemophilias, etc., down to even patients of leukemia being treated. You know, people say, how can you prevent leukemia? No, you can't. You may not be able to prevent leukemia. There are not many things which you can do to prevent leukemia. But over the last 3 decades, there is a steady improvement in the results of patients who have been treated with leukemia. And believe me, no new drug has come in the last 4 to 5 decades for the treatment of leukemia. So what is that improvement due to? It is because of our better understanding of preventive care to prevent infections, anticipate bleeding disorders in these patients, and anticipate when is a patient likely to get sick. And that has made a tremendous difference. I mean, in the last 3 decades, I've seen the improvement in the cure rates in my own institution going up from 40-50% to now 85 to 90% in patients of leukemia. And it is by no means because of the drugs. It is because of prevention, better supportive care, and anticipatory, listening. So I think it is a brilliant move on the part of Dr. Tripathi. And I think it is going to show us the light of the day. In fact, yesterday only I was discussing it with a common friend who was part of the team in Ministry of Health. And we discussed it about this preventive, and her refrain was that this should be set up in every district and every medical college. So that's the kind of importance this clinic is being given at the central level. I think, thank you very much for inviting me for this momentous occasion. And all I can say is brilliant and absolutely fantastic. You've shown us the light of the day. Thank you.
Thank you, Dr. Anupam sir. He has been a doyen of pediatric hematology oncology in India. It's been a privilege, sir. Now may I request our Honorable Vice Chancellor, Dr. Bipin sir, to give us his blessings and address us.
Professor A.K. Tripathi, Head of Department of Clinical Hematology, Professor Tulika Seth, Professor at the All India Institute of Medical Sciences, Delhi, Professor Anupam Sachdev, a consultant at the Sir Gangaram Hospital at Delhi, deans, heads of departments, faculty, Department of Clinical Hematology, residents, students, distinguished guests, ladies and gentlemen. Let me begin with by saying that I'm absolutely delighted to be participate in this very fascinating seminar on preventive hematology, which I'm told is the first of its kind in the country. And I'm delighted that King George Medical University is taking the first step in that direction. Well, friends, ladies and gentlemen, let me begin by saying there is an old adage which says that prevention is better than cure. We all know it, but do we understand it? That is the big question. Notwithstanding the do's and don'ts of what we should do and what we should not do, we know that there are preventive strategies. We know that in today's concept, we're talking of hematological problems, and two basic things that it actually includes is hematological malignancies and anemias of various types. So let's talk just a wee bit about malignancies. We all know cancer prevention strategies. They are well acknowledged. Everybody knows what they are. Avoid tobacco, have a balanced diet, avoid obesity, exercise regularly, alcohol in moderation, quality sleep, get vaccinated, avoid solar radiation, prevent exposure to radiation to industrial or environmental toxins, especially in preventing hematological neoplasms. Now, we all know this, yet there is a saga of hematological problems, malignancies, which carries on. Because we do not adhere to the do's and don'ts of what should be done. And therefore, the concept of preventive strategies. And I think it's also very important to note and that bone marrow is one of the most radio-sensitive organs of the body. And there is a clear risk of developing various types of leukemias, myelodysplastic syndromes after high to moderate exposure of ionizing radiation. I think that's really something that is in the backdrop we have to understand and remember at all times. We know that high risk of deferred leukemia has been described following radiation exposure in childhood. Whereas the majority of exposures are low dose, but if you take cumulative things of background radiation, diagnostic medical tests, and occupational exposure, it can become dangerous in times to come. Like, you know that a CT scan gives you about 1 to 10 millisieverts of radiation, depending on the type of CT that you're doing. But look at it from a long-term perspective, it can actually become dangerous in times to come. And therefore, I think even these low-dose radiations required to be kept into perspective. Infections, viral infections. We know viral infections causing causes of different types of cancers, be it things like lymphomas, the Epstein-Barr virus responsible for the Burkitt lymphomas, various types of hepatitis B and C infections as also being associated with non-Hodgkin's lymphomas. So the association of virus, the association of radiation causing hematological malignancies is really knowledge that we have. Yet, have we instituted the preventive strategies is really what is the question. We live in very interesting times. Modern medicine, newer drug development strategies, monoclonal antibodies and targeted therapies, gene editing, molecular biology, profiling by precision and personalized medicine is now becoming very contemporary. And inroads with machine learning, deep learning, and AI have added newer paradigms in the management of some of these very difficult and complex disorders. It is, I think, in this backdrop to note that investment in preventive programs is actually the best form of health investment. We know that severe hematological diseases which are prevalent in our country, including the iron deficiency anemias, B12, folate deficiencies, what Professor Tripathi talked about, drug-induced anemias, bone marrow suppressions, thalassemias, hemophilia, thrombotic episodes, and the like. It is very heartening to note that anemia which is prevalent in our country. There has been an improvement of anemia to some extent on the socio-economic front. There have been various national programs run by the government of India. One such program was that Anemia Mukt Bharat, which was launched in September 2018. And this program which mainly focuses on social behavior and change in communication at the community level. I think it is making an impact, but much more requires to be done in the years to come. I think that really is, so improvement of the socio-economic status is one thing, but telling the people at large the do's and don'ts and what should be your nutrition, what should be your diets, what is a balanced diet. I think all of this is going to be important, and to look after our children, especially growing children, is going to be an extremely important part as far as prevention strategies are concerned. Similarly, thalassemia, which is very common in some ethnic groups, and the prevalence ranges between 1 to about 15%. Now, again, thalassemia, picking up thalassemia by doing these hematological tests, early tests, and then genetic counseling, and try and separate and try and decrease the burden of thalassemia in society is what we are talking about as far as, because if you can pick up the traits and try and avoid having progenies with thalassemia major traits, I think that would really be what we are looking at. Now, also hemophilia, which again is, I know that in KGMU we got a very vibrant anti-hemophilia society, which the KGMU Department of Hematology is running that society. I think it's a very disabling disease, friends, ladies and gentlemen, and I think it's so important that general awareness in the society. How can you educate your people how to prevent injuries in hemophiliacs? How should they resort to early treatment when they get injured to prevent disability, which can be hugely disabling as far as these growing children is concerned. I think these awareness programs, education of the public at large, I think are going to go a long way in as far as as we reach out to society at large. And this, I think, is one of our very important responsibilities. Friends, ladies and gentlemen, prevention, they say, is half the cure. And higher the awareness, the better the prevention. So early screening for early diagnosis continues to be the cornerstone for early diagnosis and optimal outcomes. So preventive hematological strategies to prevent anemia, newer management protocols for thalassemia, sickle cell, hemophilia, and hematological malignancies with gene editing, molecular biology tests, stem cell, bone marrow transplants have been the defining moments in the history and growth of clinical hematology. Prevention strategies continue to be center stage today as the monetary costs of diagnosis and treatment and follow-up continue to drain economies around the world. Towards that extent, I'm delighted to see the Department of Clinical Hematology of KGMU is taking a lead and spreading awareness and being a crusader for preventive hematology in our part of the world. So once again, I congratulate Professor A.K. Tripathi and his very dynamic team. I warmly welcome Professor Tulika Seth from the Department of Hematology, AIMS, and Professor Anupam Sachdeva in this program. And I wish you all this seminar a resounding success. Thank you, ladies and gentlemen.
Thank you, sir, for your inspiring words of wisdom. We seek your blessings and hope that the Preventive Hematology Clinic will pave the way for a new era of preventive hematology in the country for one and all, even to the people at the grassroots level. Now, may I request Professor Vineet, sir, to speak?
Thanks.
So may I now request all our esteemed guests to take the front seat so that... So before that, may I request Professor Vineet to...
Thank you, Honorable Vice Chancellor Lieutenant General Puri, Dr. Anupam Sachdev, Professor Tulika Seth, Professor Tripathi, my dear colleagues, ladies and gentlemen. It is indeed a great pleasure to be a part of this inaugural ceremony of the first hematology clinic, preventive clinic, which is to be opened in this university. And I congratulate Dr. Tripathi, Dr. Verma, and Shastri for their effort. I'm sure, as Professor Muri mentioned, prevention is better than cure. I'm sure it will lead to less morbidity and mortality. And I congratulate once again the department for this endeavor. Thank you.
Yes. May I request now Professor Tulika for her talk on preventive hematology. She has been an active advocate of public health in India for so long. She has been a Master's in Bioethics NIH Fogati, NAMS Fellow, and advisor to Delhi School of Public Health. May I welcome you, ma'am? Slides. Yes, please.
Yes, sir.
So, thank you again for this very warm and wonderful welcome. Lucknow is actually my hometown, so I'm very happy to be here. And I congratulate Professor Tripathi and his team, and I'm so honored by the Honorable Vice Chancellor, Lieutenant General Vipin Puri, to come here to my hometown to talk about something which is very close to my heart, which is preventive hematology. So congratulations again for this far-sighted, visionary department. Now, hematology, as you all are very well aware, includes the diagnosis, treatment, and prevention of diseases of the blood and bone marrow, which also includes the immunological, hemostatic, and vascular systems. And by the very nature of blood, it affects our understanding of so many diseases. So what does hematology encompass? You've already heard about the malignant hematology, which includes all the leukemias, both acute and chronic lymphomas, multiple myeloma, MPNs, so many disorders. And also the non-malignant. I prefer the term non-malignant to benign because many of these so-called benign hematology disorders are actually life-threatening. For example, HLH, which we now talk about a lot in the COVID era as the cytokine storm. This used to be a rare entity that hematologists only would diagnose and manage, and now everyone is aware of it. Stem cell transplant, gene therapy, CRISPR technology are now the new agents that we have to cure potentially incurable patients like multiply relapsed leukemias, multiply relapsed multiple myeloma. They can now be cured in this day and age. Consultative hematology is something that we do a lot of at AIIMS, and there's practically no department that we don't interact with. And in fact, we're actually the favorites of a lot of the surgeons because we help them operate many very difficult patients with bleeding disorders, low platelets, anemias, etc. So now what I feel is that hematology is at the cusp of a new era, and preventive hematology is going to make this better. And hematologists, I feel, are really just nothing but good doctors. Prevention, as already been mentioned, is a very important entity because we go upstream. We don't tackle the problem when it has happened. We try to prevent it. And the usual pillars of this are primary, secondary, and tertiary prevention. So what exactly do we mean by prevention? So prevention can be many things. It can be public health, it can be legislation, it can be immunization. And in primary prevention, we aim to reduce the injury caused by the disease before it actually happens. Secondary prevention is screening, so that's early diagnosis. And that is really important because, as mentioned, many diseases like hemophilia are actually only diagnosed once they cause disability. Tertiary prevention, again, aims to limit the impairments caused by the disease. Now, but is that the only path that we have? Is actually prevention has expanded. We now have even primordial prevention where we look at the risk factors of a disease much earlier, and quaternary prevention, we look to prevent iatrogenic disease and environmental controls. So with all of this, is this enough? But we are now living in really interesting times. We now have technology at our hands. In India has a cell phone, and it doesn't always have to follow the routine ways that things are developed. Everybody did not have a landline in India, but now almost everyone has a cell phone. So things can move differently. And now if you look at preventive healthcare, there are now 13 themes that they talk about. And these themes are very, very vast, but they are also very pertinent because things like medicine, technology, all of these can actually be used. So epidemiology has been done quite vastly in our country. ICMR has done a lot of work in the hematology field. They have mapped out thalassemias, they've mapped out many diseases. But now with the integration of public health and pre-medicine is actually the preventive medicine that we talk about, the health promotion, disease prevention, and health protection. But we also have P4 medicine, where we predict outcomes. So as Dr. Anupam said, for leukemias, we can predict when complications happen. Similarly, in thalassemia, we can predict 2 years before a patient has cardiac failure, we can predict that they're going to have that by a T2 star MRI. Personalized medicine and participatory aspects of healthcare are very important now. We know that all patients don't behave the same, and patients have rights, and their participation ensures better compliance. Omics is a vast field, right from genomics to transcriptomics, proteinomics, and this has really revolutionized many of the drugs that we have as well as their drug delivery. Nutrition, this I think rather than going modern, I think we need to go back. The traditional diets that we had were actually much, much better. We see so much B12 deficiency nowadays. But if you ate a traditional vegetarian diet, which was common in North India, you would not be getting B12 deficiency because you would be eating fermented foods, which would supply the B12 that you need. And lifestyle, of course, right now, everybody is under stress because of COVID, but our lifestyles have really deteriorated. Oncology, of course, I don't need to talk about. Everybody knows how important it is. And we now have preventive pharmacology where medications can be given before a disease happens to prevent it. The environment is really, really important. And information technology apps are now coming to place. We are using an app for hemophilia to identify bleeds, to link patients in thalassemia to different blood transfusion centers. And some fields which I think we have been lagging behind are the health economics. In several countries like Australia, before any new or expensive drug is introduced, they do an extensive study on health economics to see what will be the actual cost of the drug and what will be the benefit. And so these are many things that are there to look at preventive hematology. And the most important and overarching is public policy and health policy. And we must remember, as doctors, we are responsible for guiding and informing the government. So unless we are informed and well aware of the consequences of the disease and how to prevent and understand all the finance and other things, we will not be able to give good guidance. And with all of these things, we are now going to have a revolution in healthcare. So why do we need preventive hematology in India now? Yes, it's new, but also I think COVID has given us a very important time to look at what is happening and to reset things. If we don't, we are definitely going to have major problems in the future. So one of the things that my colleagues and I had thought about was thalassemia major. And currently data shows that we have about 1.5 lakh patients of thalassemia major in India at present. So Dr. Sujata Sinha and some colleagues and I, we did an analysis and we looked to see the need for prevention of hemoglobinopathies. And at that time in 2019, when we wrote this paper, we had data to suggest that there was about 1.5 thalassemia major patients and about 1.2 lakh sickle cell patients. And looking at an average birth cohort of 25 million, and with the predicted data that we have of 12,000 thalassemia major births per year, over the next 10 years, we would be adding an additional 1.25 lakh more children with thalassemia major. And this would increase the projected blood requirements to 9.24 million units by 2026. So it seems like a lot of blood, and it is, because we actually only collect about 10 million units of blood total in our country. And this would also increase the budgetary requirements. So this was really a catastrophe. And this is just the tables from the article where we had done this analysis. And not only that, we would see an 80% expenditure in healthcare in treating these patients. So here is a crisis which needs control. But is it possible to control hemoglobinopathies? Yes, there are several countries that have completely stopped the birth of thalassemia major babies by good counseling and prenatal testing. So this is a thing that can happen. And even though many of our seniors have been recommending this for many years, the first initiative started in 2015, and in 2016, with many of my colleagues and seniors, we were able to develop the guidelines for prevention and control of hemoglobinopathies in India. And this is a Government of India manuscript that you can get on the website. And now in 2019, we have the integrated centers for hemophilia and hemoglobinopathies in many of the district hospitals. So a lot has been done, but much more needs to be done. So this is the guideline that has come. And as I said, the government only has the wherewithal to do it, but we have the responsibility to guide the government. Sometimes the government may not be able to do everything, and that is where the CSR, the corporate social responsibility, comes in. And we have a very fine example of the hematopoietic stem cell transplant project, which supports bone marrow transplants for thalassemia major patients, and this is through the Coal India Limited. Now, we had talked about T2 star MRI. Now, this is something which is fairly expensive, and the reason for that is the program that is done is a proprietary program. So at AIMS, what we did was we did a project, and we have now made our own validated program, which is completely free. It was done with the University College of London, who are actually the innovators of cardiac MRI. And what we did two things. One, we reduced the time. So usually it takes about 30 minutes to 1 hour to do a cardiac MRI. And that is why it's also expensive in the private sector. We now have a rapid sequence MRI, which can be done from start to finish in 8 minutes. And the formula is completely free, so anybody who wants to establish this can do it with their conventional machines, and they don't need to buy the proprietary material that has to be licensed every year. Now, economics is really important, and I think this is where often we do penny pinching, not realizing that that not spending money now is actually going to cost us money in the future. And this is what has happened in hemophilia. In hemophilia, we hardly have many patients on prophylaxis. Prophylaxis is regular replacement therapy that is given to prevent bleeds. What we do is on-demand therapy. After the patient has had a bleed and most likely had damage to the joint, we give them factor. Most countries, even countries like Brazil, most patients are on prophylaxis. And this was a lecture that I had given back in 2017 to the government. And there's a lot of data to suggest that prophylaxis is vitally important, and it doesn't have to cost more money. In fact, it's actually a sensible way of spending money. In the study from Sweden, they actually compared the cost of on-demand therapy and prophylaxis over a period of time. And what they found was that the cost was the same. Why was it the same? It was the same because when you give on-demand therapy, the patient gets disability and then requires joint replacement surgery. And for that, you have to pay for the cost of the joints, and you have to pay for 100% correction for the surgery and physiotherapy. While you could have used smaller doses of factor over the life of the patient and had let him have a pain-free life and a productive life where he could have been a tax-paying citizen. So these are important things to understand and for us to talk to the administrators to inform them. We now have a Novo Nordisk hemophilia project, which is being done to harmonize the best practices in 7 of the national hemophilia centers in the country. Prenatal diagnosis is paramount importance to prevent genetic disorders like hemophilia, thalassemia, and sickle cell disease. And for this, though, we need a lot of awareness in the public because we can't force them to do this. So it's really important that we have the awareness, the counseling, and then the facility for the testing. And this is now being done in many of the government centers, and more will be coming out with the new programs that are in place. And towards genetic counseling, we have already established a course which is to train genetic counselors to make sure that they give the information in a very empathetic and non-judgmental way, because bad counseling can sometimes be very hurtful and detrimental to the family. Sickle cell disease, we had earlier thought that this was not a huge issue, and we were approached by the Ministry of Tribal Affairs because the data that we now have suggests that we have not 1.2 lakh sickle cell patients in our country, but 14 lakh sickle cell patients in our country. And that is probably an underestimation because many tribal areas have not been mapped. And sickle cell disease, unlike thalassemia, which is primarily a disease where you have anemia and blood transfusion is the main treatment, sickle cell disease affects the whole body, leading to inflammation, crisis, and cardiac and end organ damage. And we are fortunate that the Ministry of Tribal Affairs, as well as the Ministry of Health, along with Dr. Anupam, who's here, has now taken this up in a big way. And there's a training module which is going to be coming out soon, which includes the best data and evidence right from the work that has been done by ICMR to all the information we have about transplant and soon to be coming gene editing. So this is going to be a training module so that every doctor will be able to provide the very best of care to each and every sickle cell patient who deserves it. And some of the point of care devices that are coming out in sickle cell are also going to be really important and will improve access to care. One of the limitations that I found was diagnosis. I'd gone for a training program in Jharkhand and I started a lecture in which I was going to be talking about sickle cell disease with, I'm sure all of you have many sickle cell patients, and my audience was blank. And I realized that, something was wrong. And when I talked to them, I found out that in the whole state of Jharkhand, there was one HPLC machine. And that was the reason why they could not make a diagnosis. And when I talked about how the sickle cell patients presented and the different types of crisis, everybody shook their head and said, yes, we see lots of patients like that, but they weren't able to make a diagnosis. And this is why these new point of care devices, which don't require electricity, which don't require a hematologist in order to diagnose the HPLC curves, are going to be really, really important and provide the diagnosis at the place, whether it's in the village or the PHC, and it can be even done by an ASHA worker. So these are simple tests which don't even need a phlebotomy, just a finger prick. So these are some things that are going to come up. G6PD deficiency is really important. It can lead to life-threatening kernicterus. And again, simple tests, point-of-care tests can diagnose this even in remote villages. Now, patients on the whole want to work, they need education, and they can contribute to society. So with all of this, we need to look at health economics. And health economics doesn't apply just to some genetic conditions, but it can apply to all of the things that we have. Many times as hematologists, we do things to cut costs, and we actually find out that what we're doing really believe in is that low cost does not need to be low tech. And if we adopt the technology appropriately, we will be able to use the funds that we have in a better way to make sure that people have good health. We have to focus on inclusiveness, and I think the reason why sickle cell has increased so much is because it has been a very marginalized disease. So by better disease understanding, we can prevent disease by prenatal testing. We can definitely control symptoms and improve quality of life and reduce complications and limit disability of these patients. So thank you very much. And again, I congratulate you and your team on your vision and pioneering spirit. Thank you so much.
Thank you, madam. I'll request my residents to present few mementos to our distinguished guests. Now I'll call upon our colleague Dr. S.P. Verma to deliver the vote of thanks.
It's an honor to offer vote of thanks on the occasion of inauguration of Preventive Hematology Clinic on behalf of Department of Clinical Hematology, KGMU, Lucknow. First of all, I would like to thank our respected Vice Chancellor, Lieutenant General Dr. Bipin Puri, sir, for being a continuous source of inspiration and the guidance force behind this theme. Thank you, sir, for igniting such innovative ideas and your presence in this meeting. I would like to thank our guest of honor, Dr. Anupam Sadeva, sir, for accepting our invitation on a very, very short notice and making it possible to attend this meeting and enlighten us with the words of wisdom. My sincere thanks to Professor Tulika Seth, ma'am, for her gracious presence and taking us through the area and scope of preventive hematology. Her words of wisdom will definitely open many areas where we can proceed and work on it to make our concept of preventive hematology successful. I would like to also thank Professor Vineet Sharma, sir, our Pro Vice Chancellor, for his support and guidance, and his presence always inspires us for getting ahead. My sincere thanks to all the respected head of departments, my seniors and colleagues sparing their valuable time in attending this inauguration ceremony on this occasion. We need support and suggestion from all of you in future. Thanks to all the members of various societies like Hemophilia Society, we have Manchanda Jaya, Thalassemia Society, and other non-government organizations for their valuable presence here. We will definitely need your help and advice in proper functioning of this preventive hematology clinic, and definitely will go hand in hand to make it successful. Thanks to the staff members of Department of Hematology who have worked untiringly doing efforts and making this event very successful. At the end, I would like to thank all the representatives from print and electronic media for their wide coverage of this program and also helping spread this to the society so that more and more people get benefited from this concept of preventive hematology. So thank you all once again and for your valuable time and presence for this inaugural meeting. Thank you all. Now we can proceed for tea. And after that, there will be a video on anemia. So our distinguished members can leave, but those who can be here, they can have the view of this video on anemia. Thank you.
He's really nice, right? He helped us so much. We bothered him so much during the COVID.
जब देखो तब भागती रहती है, सारा खेल इसने चौपट कर दिया, को तो खिलाने वाला नहीं है।
क्या हुआ, तुमसे कुछ काम हो नहीं पा रहा क्या? अगर काम नहीं करोगे तो शाम तक एक भी पैसा नहीं मिलेगा तुमको। चले आए वहां से काम करने, काम होता नहीं, वादा बना रखा है बिल्कुल।
काशी, देखो आज मैं तुम्हें पेन होल्डर बनाना सिखाता हूँ, ठीक है? ये एक हमने ग्रीन पेपर लेकर के पहले राउंड किया, ठीक? और ये आइसक्रीम स्टिक है, इसमें ये आइसक्रीम स्टिक से हमने गोंद लगा कर, किधर देख रही हो? तुम्हारा काशी तुम्हारा मन ही नहीं लग रहा, क्या बात है? कहाँ देख रही हो?
क्या करूं मास्टर जी, आजकल किसी काम में मन ही नहीं लगता।
सारा दिन पकड़े रहते हो, कभी पढ़ाई लिखाई तो कर लिया करो।
पढ़ने में मन नहीं लगा, मैं क्या करूँ?
एक भी काम ढंग से नहीं करती है, मैं तो ऐसी भुला के पछता रही हूँ।
इतना सारा खाता हूँ, पता नहीं फिर भी थकान मुझे इतनी क्यों रहती है।
ओम ह्रीं क्लीं चामुंडाय जय विच्चे, 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 ओम ह्रीं क्लीं चामुंडाय जय विच्चे। रामू, तेरी पहली बीवी को बच्चा होते समय ना वो चुड़ैल खा गई थी।
बाबा मैं अपने बेटे को भी नहीं बचा पाया।
देख इसकी हालत, वैसे की वैसे ही है। और इस बार तूने कोई उपाय नहीं किया ना तो वो चुड़ैल तेरा वंश कभी भी नहीं आगे बढ़ने देगी।
नहीं नहीं बाबा, मुझे अपने पोते का मुंह देखना है बाबा।
बाबा आप जो भी उपाय बताएंगे मैं करने को तैयार हूँ।
ठीक है, पैसे की व्यवस्था करके हमारे स्थान पर आ जाना, जो भी उपाय होगा हम जरूर बताएंगे। ओम ह्रीं क्लीं चामुंडाय जय विच्चे, ओम ह्रीं क्लीं चामुंडाय जय विच्चे।
लो बेटा, इसे खा लो। नहीं मुझे नहीं खाना है। ये तो कोई बात नहीं होती बेटा, बाजार की चाट तो तुम बहुत शौक से खा लेते हो, ये भी खाया करो। नहीं माँ, मुझे ये सब नहीं अच्छा लगता। अच्छा एक पीस तो खा लो। नहीं माँ, नहीं खाना है मुझे।
नहीं चाहिए अम्मा। बेटा रामू, बहू की हालत तो दिन ब दिन बिगड़ती ही जा रही है बेटा। पता नहीं नसीब में दादी बना लिखा भी है या नहीं बेटा।
क्या करे अम्मा, ओझा के सभी उपाय तो कर डाले, लगता है किस्मत ही खोटी है।
देखा आपने, अंधविश्वास और नासमझी के कारण ऐसा ही होता है।
तो हम लोग करें क्या?
ऐसी दशा में जरूरी है डॉक्टरी सलाह लेना।
अरे आपको तो एनीमिया है। आपको तो एनीमिया है। अरे आपको तो एनीमिया है।
इसे तो एनीमिया है।
अरे आपके तो एनीमिया है।
तुम्हें तो एनीमिया है।
डॉक्टर साहब, ये मेरी बहू है, इसका बच्चा बार बार खराब हो जाता है।
रिपोर्ट दिखाओ जरा इसकी।
अरे इसको तो एनीमिया है।
ये एनीमिया क्या होता है?
आम बोलचाल की भाषा में इसे खून की कमी भी कहते हैं, और ये खून में हीमोग्लोबिन की कमी से होता है।
ये हेमोग्लोबिन क्या होता है?
मैं बताता हूँ। हमारे शरीर की रगों में जो खून होता है उसमें मुख्यतः दो चीजें होती हैं, प्लाज्मा और कोशिकाएं। कोशिकाओं में लाल रक्त कोशिकाएं, श्वेत रक्त कोशिकाएं और प्लेटलेट्स। लाल रक्त कोशिकाएं जिनको रेड ब्लड सेल्स बोलते हैं, इनमें हीमोग्लोबिन होता है जिसकी वजह से खून का रंग लाल होता है। हीमोग्लोबिन का कार्य है हमारे फेफड़ों से ऑक्सीजन ले करके शरीर के अंगों तक पहुंचाना, जिससे हमारे शरीर को ताकत मिलती है, ऊर्जा मिलती है। अब आप जानना चाहेंगे कि हीमोग्लोबिन होता कितना है। सामान्य पुरुष में हीमोग्लोबिन की मात्रा 13 ग्राम से 16 ग्राम प्रतिशत, और एक स्वस्थ महिला में हीमोग्लोबिन की मात्रा होनी चाहिए 12 से 14 ग्राम प्रतिशत। अगर हीमोग्लोबिन की मात्रा इससे कम होती है तब इस स्थिति को एनीमिया कहते हैं।
एनीमिया हम लोगों के लिए एक चुनौती है।
चुनौती वो कैसे?
हमारे देश की बहुत बड़ी जनसंख्या एनीमिया से ग्रसित है। इसके कारण लोगों में काम करने की क्षमता में भी गिरावट हो जाती है और इससे देश के विकास पर भी असर पड़ रहा है।
शरीर में हीमोग्लोबिन की कमी कैसे हो जाती है?
हीमोग्लोबिन बनने के लिए हमारे भोजन में आयरन, इसे लौह तत्व कहते हैं, विटामिन B12, फोलिक एसिड और प्रोटीन का होना जरूरी है।
डॉक्टर साहब, अच्छा खाता पीता हूँ, फिर भी मुझे एनीमिया क्यों हो गया?
हीमोग्लोबिन कम होने का एक कारण यह भी है संतुलित भोजन न करना। कभी कभी अन्य बीमारियों में भी हीमोग्लोबिन कम हो सकता है।
कौन कौन बीमारियों से हीमोग्लोबिन कम हो जाता है?
गुर्दे, कैंसर, लीवर और थैलेसीमिया जैसी बीमारियों में भी हीमोग्लोबिन कम हो जाता है। कभी कभी चोट लगने पर या प्रसव के दौरान रक्तस्राव होने से भी हीमोग्लोबिन कम होता है, जिससे एनीमिया हो जाती है।
किशोरावस्था में एनीमिया ज्यादा होता है।
डॉक्टर दीदी, ऐसा क्यों होता है?
किशोरावस्था में तेजी से बढ़ते हुए शरीर और लड़कियों में माहवारी के कारण आयरन व पोषक तत्वों की कमी हो जाती है, जिसकी वजह से एनीमिया हो जाता है।
खान पान पर सही ध्यान न देने से गर्भवती महिलाओं में एनीमिया ज्यादा होता है।
हम सब के लिए ये चिंता की बात है कि भारत के विकास के लिए, एक स्वस्थ समाज के विकास के लिए मातृ मृत्यु दर एक बहुत बड़ी रुकावट है।
डॉक्टर साहब, ये मातृ मृत्यु दर क्या होता है?
मातृ मृत्यु दर, इसका मतलब है कि बच्चे को जन्म देते समय माता की मौत हो जाना। एनीमिया भी इसका बहुत बड़ा कारण है और ऐसी दशा में कई बार बच्चा भी स्वस्थ पैदा नहीं होता और उसकी जान का भी जोखिम बना रहता है।
एनीमिया की वजह से ही बार बार इसका गर्भपात होता है। एनीमिया एक ऐसी बीमारी है जिसकी वजह से बच्चे का दिमाग विकसित नहीं हो पाता है और डिलीवरी के समय पर माँ का हार्ट फेल होने का भी डर बना रहता है। एनीमिया की वजह से ही प्रसव के समय बहुत अधिक रक्तस्राव होता है और बच्चे और माँ दोनों की जान का खतरा बना रहता है।
डॉक्टर साहब, क्या ऐसा हो सकता है कि एनीमिया की बीमारी का पता हम लोगों को शुरुआत में ही लग जाए?
निश्चित तौर पर एनीमिया का पता डॉक्टरी जांच से ही होता है, लेकिन कुछ दशाओं में आप एनीमिया होने का संदेह कर सकते हैं।
डॉक्टर साहब, ऐसी कौन सी दशा है?
काम करने में थकावट महसूस होती है, सांस फूलती है, चक्कर आते हैं, पढ़ाई में, खेल कूद में और घरेलू कामों में मन भी नहीं लगता है।
किशोरियों में एनीमिया होने से माहवारी रुक सकती है और या फिर अनियमित भी हो सकती है। ऐसी दशा में डॉक्टर को दिखाकर खून में हीमोग्लोबिन की जांच अवश्य करा लेनी चाहिए।
डॉक्टर साहब, क्या एनीमिया होने से बचा जा सकता है?
आयरन युक्त संतुलित भोजन करने से कुछ हद तक एनीमिया से बचा जा सकता है।
डॉक्टर साहब, ये आयरन युक्त संतुलित भोजन क्या है?
संतुलित भोजन में अच्छी मात्रा में आयरन, विटामिन और प्रोटीन होना चाहिए। एनीमिया से बचने के लिए हमें संतुलित भोजन करना चाहिए, जैसे कि
मेथी, बथुआ, सरसों, चौलाई, पालक आदि हरी पत्तेदार सब्जियां, गुड़। अंकुरित दालों में आयरन यानी लौह तत्व की मात्रा अधिक होती है। भोजन में इसके साथ टमाटर, नींबू, संतरा, आंवला, अमरूद आदि विटामिन C युक्त फलों का सेवन अधिक लाभदायक है।
ये भी जरूरी है कि किशोरियां हफ्ते में एक बार भोजन के बाद आयरन की गोली जरूर लें।
डॉक्टर दीदी, ये गोली हमें स्कूल में खिलाई जाती है।
बिल्कुल ठीक कहा तुमने, लेकिन स्कूल न जाने वाली लड़कियां और गर्भवती महिलाएं, उन लोगों के लिए आंगनवाड़ी केंद्र में आयरन की गोलियां मुफ्त में दी जाती हैं। वो वहां से लेकर भी खा सकती हैं।
डॉक्टर दीदी, कभी कभी गोली खाने से उल्टी भी होती है।
आयरन की गोली खाने से उल्टी हो सकती है, लेकिन ये तब होती है जब खाली पेट खाया जाए। इसलिए आयरन की गोली को कभी भी खाली पेट नहीं खाना चाहिए। खाना खाने के 1 घंटे बाद पानी के साथ लेना चाहिए।
हाँ, एक बात और जरूर ध्यान रखनी चाहिए कि हर 6 महीने में पेट के कीड़े मारने वाली दवाई भी जरूर खानी है।
देखिए, एनीमिया की रोकथाम के लिए हमें पूरी कोशिश करनी है और जो बातें बताई जा रही हैं उनको ध्यान में रखकर लोगों को जागरूक करना होगा। हम सबको मिलजुल कर एनीमिया को दूर करना है।
मिलजुल हमने ये जाना, एनीमिया को है दूर भगाना। मिलजुल हमने ये जाना, एनीमिया को है दूर भगाना।
ओम ह्रीं क्लीं चामुंडाय जय विच्चे, सब विनाश हो जाएगा। सब नष्ट हो जाएगा। कल की आई डॉक्टर ने तुम सबको बरगला रही है, तुम्हारा सबका विनाश हो जाएगा।
और मालती, बड़ी हरी हरी सब्जियां बन रही है।
अरे नमस्ते डॉक्टर दीदी।
नमस्ते नमस्ते। और मालती कैसी हो?
जी बढ़िया, आपके कहे अनुसार सारी हरी सब्जियां बना रही हूँ। सेम, पालक, गाजर, आजकल तो यही बना रही हूँ, जिससे शरीर को मिले भरपूर आयरन।
बहुत अच्छे। और
ओम ह्रीं क्लीं चामुंडाय जय बिच्चे, सर्वनाश हो जाएगा। और तू डॉक्टर, तू तो गांव वालों को बरगला रही है ना, तेरे ऊपर तो काल मंडरा रहा है। सब विनाश हो जाएगा, सब विनाश हो जाएगा।
अरे अरे अरे, क्या हुआ?
अरे किसे बचा रही है दीदी? इसने तो पूरे गांव को बरगला रखा है।
एक डॉक्टर होने के नाते मेरा पहला फर्ज है किसी की जान बचाना। लगता है इसे अनीमिया है। आओ आओ, इसको तो अस्पताल लेके जाना होगा। चलो आओ, मेरी मदद करो।
अरे तुम्हें तो एनीमिया है।
मालती कैसी हो? जी अच्छी हूँ। और बिटिया ठीक है? हाँ जी, बिटिया भी अच्छी है। अच्छा बहन जी, ये दवाई दी थी डॉक्टर ने, ये बता दीजिए।
ये एक गोली सुबह शाम लेनी है और ये एक गोली रोज लेनी है।
अच्छा
ठीक है। और जो खान पान का बताया है वो भी सही से फॉलो करना
जी।
और ठीक हो तुम?
डॉक्टर दीदी, अब आपकी कृपा से बहुत आराम है।
चलो बहुत बढ़िया। अब तुम अनीमिया के खतरे से बाहर हो।
देखा, ये वही डॉक्टर दीदी हैं जिन्होंने तुम्हारी जान बचाई और जिन्हें तुम कोसा करते थे।
मुझे माफ करिएगा बहन जी, और अब मुझे और शर्मिंदा मत करिए।
ठीक है, लेकिन अब अंधविश्वास में मत पड़ना। और अगर गांव में भी कोई बीमार होता है तो उसको यही सलाह देना कि पहले डॉक्टर से परामर्श ले।
ठीक है दीदी, अब मैं कभी खुद भी झाड़ फूक नहीं करूंगा और ना ही किसी गांव वाले को अंधविश्वास और किसी झाड़ फूकों में पड़ने दूंगा।
बहुत बढ़िया।
डॉक्टर दीदी, अब मैं भी आप लोगों के साथ एनीमिया जागरूकता अभियान में बढ़ चढ़ के हिस्सा लूंगा।
बहुत बढ़िया। देर आए दुरुस्त आए।
जंजीरें ना समझी की तोड़ चले, दौर नया आया है सेहत की छाव तले। अब न करेंगे कोई बहाना, एनीमिया को है दूर भगाना। मिलजुल हमने ये जाना, एनीमिया को है दूर भगाना। ज्ञान की बहेगी अब निर्मल धारा,
हुनर से हमने अपने जीवन को है संवारा।
निकल पड़े परिवर्तन की अलख जगाने को, मचल रहे हैं आसमां पर छाने को।